Have you ever wondered, why is it that in the same environment, the same type of disease attacks, some people overcome it easily, while others suffer severe consequences? The answer may lie in something very simple but extremely important: vitamin D. It's not just the sunshine vitamin you've heard of. It is the commander of the immune system, the silent bodyguard that protects your body from disease. In particular, in the fight against COVID-19, vitamin D has been compared to a golden shield to help reduce the risk of serious complications. In the video we will reveal the secret to how powerful vitamin D promotes health. The surprising connection between vitamin D and COVID-19 that very few people know. And most importantly, how can you and your family make the most of this power? Let's start now. Part 1. What is vitamin D and why is it important? Builds strong bones and teeth. It helps the body absorb calcium and phosphorus, two essential components of bones. Regulates nerve and muscle function. A stable amount of vitamin D also supports brain clarity and muscle flexibility. For young children, leads to rickets, bowed legs, or delayed development. For adults, causes osteoporosis, chronic pain, and even increases the risk of cancer. And in particular, vitamin D deficiency weakens the immune system, making the body susceptible to dangerous diseases such as flu, pneumonia, or most recently COVID-19. Why do many people lack vitamin D? Biological characteristics: older people or people with darker skin synthesize vitamin D less effectively. Of special importance during the COVID-19 epidemic. Recent studies have proven that people with sufficient levels of vitamin D, this is why vitamin D is called the silent bodyguard. Quiet during the pandemic. Part 2. Vitamin D and the relationship with COVID-19. 1. Vitamin D and its role in the immune system. Our immune system is a protective shield against pathogens. Vitamin D is not only a nutrient but also acts as a commander, supporting the production and functioning of cells. 2. COVID-19 and the risks of a weak immune system. When COVID-19 attacks the body, the immune system plays a role in determining the severity of the disease. Vitamin D levels in the blood are lower and more likely to become severe. 3. Outstanding studies on vitamin D and COVID-19. A study in Spain found that 82% of severe COVID-19 patients were vitamin D deficient. A trial in the UK showed that people with high blood levels of vitamin D had a 54% reduced risk of severe complications when infected with COVID-19. 4. Vitamin D helps reduce cytokine storm. When the body is faced with a virus like SARS-CoV-2, the immune system activates inflammatory responses to destroy the virus. Of cytokines, signaling molecules, leading to a severe inflammation called cytokine storm. Imagine your immune system as a fire used to burn viruses. This is how cytokine storm causes severe damage, especially in the lungs. Vitamin D helps regulate the immune system, keeping the inflammatory response from exceeding necessary levels. Vitamin D stimulates the production of anti-inflammatory cytokines such as IL-10, while inhibiting inflammatory cytokines such as IL-6, TNF-alpha. A study at Northwestern University, USA, showed that COVID-19 patients with low vitamin D levels are more susceptible to cytokine storms, leading to lung damage and higher mortality rates. Significantly reduced inflammatory indicators such as CRP and IL-6. The clear difference between people with adequate and deficient vitamin D is not only overall health, but also the chance of survival in the face of dangerous complications of COVID-19. 5. Which group of people needs vitamin D the most? Old person. Reason: as we age, the body's ability to synthesize vitamin D from sunlight declines. People with dark skin. Reason: melanin in the skin can reduce the ability to absorb vitamin D from sunlight. Quote, when the body has to fight disease, the need for vitamin D not only supports bones but also helps the immune system become stronger. Pregnant and lactating women. Quote, pregnant and breastfeeding women need high levels of vitamin D to not only nourish their bodies but also to ensure the healthy development of their babies. People with little exposure to sunlight. Reason: people who work in closed environments, live in areas with little sunlight or in areas with cold climates all year round may not get enough vitamin D from sunlight. 6. The truth about vitamin D and COVID-19 vaccines. This means that vitamin D helps the body produce more antibodies, thereby increasing its ability to protect against viruses. Fact: vitamin D does not replace the COVID-19 vaccine. While vitamin D has many benefits in supporting the immune system and optimizing vaccine effectiveness, it cannot replace the COVID-19 vaccine. The combination of adequate vitamin D supplementation and COVID-19 vaccination can help you not only protect yourself from the virus, Please make sure you maintain ideal vitamin D levels, so your body is always ready to deal with any challenge. Part 3. Common misunderstandings about vitamin D. 1. Vitamin D can only be obtained from sunlight. Vitamin D is made when your skin is exposed to sunlight, and dairy products fortified with vitamin D. In addition, the use of vitamin D supplements is also recommended. Your body may lack vitamin D if you don't supplement it from other sources such as food and pills. 2. Vitamin D can cure all diseases. Vitamin D is important for health, but it is not a cure-all. Vitamin D cannot cure every disease. Vitamin D plays an important role in maintaining health, but if you are suffering from a serious illness, consult your doctor and get proper treatment. 3. Vitamin D is not harmful when overdosed. However, excessive vitamin D supplementation can cause serious side effects, such as vitamin D poisoning, hypercalcemia, and kidney and cardiovascular damage. Although vitamin D is very good for health, an overdose can also cause serious harm. And according to your doctor's instructions to avoid dangerous side effects. 4. Vitamin D can replace drugs to treat diseases. Vitamin D cannot replace medication for serious diseases. Treatment of these diseases must be prescribed by a doctor. 5. Vitamin D can help lose weight effectively. Some studies have shown a link between vitamin D deficiency and weight gain, but vitamin D is not a weight loss method. While vitamin D can support your health, if you desire effective weight loss, combine it with a healthy diet and regular exercise. Vitamin D is just one supporting factor in the process. This program. It is important to understand vitamin D and the misunderstandings surrounding it. Take a supplement vitamin D in the right dose, at the right time and combined with a healthy lifestyle to achieve optimal health. Part 4. How to maintain proper vitamin D levels. 1. Choose foods rich in vitamin D. One of the simplest ways to maintain vitamin D levels in the body is to add foods rich in vitamin D to your daily diet. Milk and dairy products, cow's milk, almond milk, soy milk and cheese are foods fortified with vitamin D. Cereals fortified with vitamin D. Some cereals and breads are also fortified with vitamin D, making them a great choice for vegetarians or vegans. Mushrooms. Mushrooms can also provide vitamin D, especially when exposed to sunlight. 2. Take advantage of sunlight safely. Sunlight is the main natural source of vitamin D, but to maintain proper vitamin D levels. Exposure to sunlight helps the body produce vitamin D, especially in the morning or afternoon hours when the light is not too intense. 3. Use vitamin D supplements. Vitamin D supplementation can be done through vitamin D3, cholecalciferol, pills, especially those at risk of vitamin D deficiency. Vitamin D2 and D3. Vitamin D has two common forms, D2, ergocalciferol, and D3, cholecalciferol. A doctor should be consulted before using vitamin D supplements, especially for those with special health conditions or taking other medications. 4. Get your vitamin D level tested periodically. Doctors usually recommend checking blood levels of vitamin D at least once a year, people with poor diets, or people who live in places with little sunlight. Ideal blood vitamin D levels usually range from 20 to 50 nanograms/ml, but doctors will advise you on the most appropriate level. 5. Maintain a healthy lifestyle. In addition to diet and vitamin D supplementation, a healthy body will absorb and use vitamin D more effectively. To maintain stable vitamin D levels, you need to maintain a balanced diet, exercise regularly, get enough sleep and reduce stress. A healthy lifestyle not only helps maintain stable vitamin D levels, make sure you eat a balanced diet, exercise and get enough sleep for your best health. Vitamin D is not a miracle, but it is the foundation for building a healthy body. Check and supplement vitamin D today to protect yourself and your family. If you find this video useful, don't forget to like, share, and subscribe to the channel to receive more useful information.